Are you on employer health insurance, whether it's yours or your spouse's past 65, and you're trying to figure out what to do with Medicare? If so, make sure you watch this video so you're not going to fall for those confusing advertisements or even those misleading letters that you're probably getting in the mail. Let's talk about what you really need to do when it comes to Medicare to avoid overpaying for health insurance, but also avoid those penalties. I'm Emily with the Medicare Coach, the leading Medicare advocate, the independent advocate, helping you easily understand how to make your right decision, but also how to get the most out of Medicare. And 7 years ago, I helped my dad make his right Medicare decision, and I was shocked at the confusing nature of Medicare and how misleading the system is. So I look forward to, again, being your guide to help you through Medicare. Make sure that you like this video and subscribe to my channel to get more inside tips to get the most out of your Medicare benefits. You've worked hard for Medicare. Let's now get the most out of it. So when it comes to having employer health insurance and being 65, Medicare rules can be a little bit hard to figure out because one, the government doesn't really place them out there clearly as to how it works, and the insurance companies really want you to be on a Medicare plan. So most of the time, you're probably going to get scary things in the mail saying you have to enroll in Medicare, otherwise you may face penalties. Well, that's a really big may. The reality is you can absolutely delay Medicare past 65 without penalties as long as you have an employer plan that meets 3 important Medicare rules. Number 1, that employer plan must have 20 employees or more, assuming that you're 65. If you happen to be disabled before 65, that employer plan has to have 100 employees or more. Number 2, that employer plan has to have a creditable drug prescription plan. Now, a creditable plan means a plan on average covers medications as well as or better than Medicare. Your company is legally required to confirm whether or not it's creditable every single year, so your benefit person can confirm this for you. The third requirement is that your employer plan does not require Medicare Part A or B. Now, to be honest, this doesn't happen very often. I think it's a good thing to just double check about the Medicare requirements because some plans can be unique, say federal employee health benefits or other things that are out there. So just double check what those rules are, that your employer plan meets all of these 3 requirements. Now, if your employer plan or your spouse's employer plan does meet these requirements, you are likely able to delay Medicare past 65 without penalties, okay? What I don't want people to do is to be on an employer plan and also be paying for Medicare Part A and or B. Paying for both is usually a huge waste of money. I had a client who came to me a few years ago. He was 68. He was finally retiring and he wanted help with Medicare. And he says, Emily, can you help me with Medicare? Oh, by the way, I've been on my employer plan since 65, but I've also been on Medicare Part A and B since 65. And the moment that he told me that he'd been paying for both an employer plan, which met Medicare rules, and Medicare Part B for 3 years, it made me cringe because he easily wasted $4,000 to $5,000 by double paying for health insurance. It had no benefit to him, but he thought he was doing the right thing. So my point to you is let's get really clear on what these rules are, and I cover them in more details. I have some resources below, but those are the 3 main rules to look at to decide whether or not you can delay Medicare past 65. Now, just because you can delay Medicare past 65 does not mean that you necessarily should delay Medicare past 65. Most people assume that Medicare is bad health insurance, but the reality is for many people, it can be much better and less expensive health insurance than their employer plan. So for that reason, once you confirm that your employer plan does meet Medicare rules, my next recommendation is look at the cost of your employer plan and decide, are you really better off on your employer plan or are you better off on Medicare? Now, for most people, the tipping point between Medicare and the employer plan is by simply looking at the cost of your employer plan, okay? So if on your employer plan, you are paying $275 per month per person in premiums, okay? And your deductible or your maximum out of pocket, and you're hitting those numbers, are $2,000 or more a year, I highly recommend you look at what your Medicare options are. This is usually the tipping point for most people, although if you have a higher income, it can be slightly different, okay? So again, just because you can delay Medicare does not mean that you should delay Medicare. I was talking to a gentleman a few weeks ago. He's 67. He has not retired. He's still in his employer plan. He's not on Medicare yet. That's fine. But I was helping his wife get onto Medicare, but because she's now 65. And through this process, come to find out, he realized that he made a big mistake. He actually had surgery done on his knee earlier this year. And he realized that by being on Medicare, right, had he joined Medicare even at the beginning of this year and left his employer plan, it would have easily have saved him $12,000 in just that one surgery. So my point to you is this. People just assume that they can kind of lackadaisically make a Medicare decision or employer plan decision, but it's a lot more around the details of the cost if you don't want to waste money. And I don't know about you, but I think when we're all planning for retirement, a couple $1,000s makes a really big difference. And so again, if you're in the situation of having an employer plan and having the option to get Medicare, please be very thoughtful. So that way we're not, again, overlooking things that can lead to penalties later, or again, it can lead to wasting a lot of money, okay? Now, let's say that you do decide to delay Medicare. Fantastic. Most of the paperwork required to tell Medicare that you've delayed Medicare actually happens when you eventually do enroll in Medicare, okay? So the only people who have to notify Medicare at 65 that they're delaying Medicare are those who are drawing Social Security 4 months before your 65th birthday. And the reason why you have to notify Medicare is that if you're drawing Social Security 4 months for your birthday, you'll be automatically enrolled in Medicare Part A and B. And as I mentioned earlier in this video, I don't want you paying for an employer plan and also paying for Medicare Part A and B. It's usually a huge waste of money. Now, look, there are some exceptions where it makes sense to pay for both, but usually not, okay? Make sure you come to us if you're paying for both, and let's double check if that really makes sense, okay? So again, most of the paperwork happens when you eventually do enroll in Medicare at some point in the future, okay? Again, the most common mistake that I see people make is either one, double paying for health insurance, right? Paying for that employer plan and as well as paying for Medicare, or number two, assuming that your employer plan meets Medicare rules, or assuming that you're better off delaying Medicare when you actually aren't. I've seen people have huge issues with getting Medicare in the future if they do things incorrectly. So please be thoughtful and get your Medicare decision right as to whether or not you should join Medicare now or later. Now, in the comment box below or in the text box below, I've included some extra resources to help you, again, navigate this important decision. So if you found this video helpful, give me a thumbs up. If you didn't, let me know, give me a thumbs down, and make sure you subscribe to my channel to get more inside tips to help you easily make your right Medicare decision and get the most out of your benefits.